All right. So, thank you so much, everyone. A very good morning to you all for joining us today for this special webinar series on dealing with misinformation during COVID-19. This webinar is being hosted by Google News Initiative in partnership with Data Leads. So we all know today, given the current situation of COVID, one of the biggest problems around COVID is the spread of fake news and misinformation around it. We've been seeing a lot of fake news on our social media platforms, varying from consumption of alcohol, consumption of garlic, and so many other things, including absurd things like drinking cow urine might just prevent you from getting COVID. So it's because of this that we are doing these special series around misinformation, specifically around COVID. Just to give you a brief about, there are a lot of people who've joined us today, who've been our partners, who've been with us in this incredible journey since July 2018. We launched this Google News Initiative India Trading Network program in July 2018. And ever since, we've trained close to 16,000 journalists, media educators, journalism students in more than 10 different languages across India. So the impact that we created because of the Google News Initiative India Training Network is really huge. So moving on, I wouldn't take a lot of time. I would now introduce Sonia Bhaskar, who's conducting our today's webinar. She's the head of Web Synergy at NDTV India. So over to you, Sonia, and thank you so much.
Thank you, Surbi. I hope everyone can hear me. If you can, just in your chat boxes, just say yes. Okay, great. So I will now just share my screen and.
Great. Thank you.
Okay. Okay. Sorry about that. So, so basically, this is what is the agenda for today, which is identify misinformation around the COVID-19 pandemic, different types of medical information that is circulating. Like I said, the misinformation is around everything from how it originated to how it's getting transmitted to the cures to everything. I mean, you will also find misinformation about how medicines have been found, vaccines have been found. We are also doing a little thing on verification on the WhatsApp messages, because that's a huge black hole and we right now don't know lots of things that are circulating there. So there are some tips, etc., to how to kind of tackle if you get a message on WhatsApp. Then the common myths around the virus and the cure, like I spoke about, and we'll do some basic tips on tools on image and video verification. This is what Dr. Tedros, the Director General of WHO, said when about this, what is going on right now, that we are not just fighting an epidemic, we are fighting an infodemic. There's just too much of information around and not all of it correct. And from WHO to each and every country and media organizations, governments are right now, apart from tackling the spread of the disease, are also tackling and in trying to work hard to keep people informed with the correct, credible information. Because the point is that we know a lot of things about COVID-19, but it's a new strain of virus. So as we go along, scientists are working around the globe and we're discovering new things about it. So what do we know about it till now? We know that it started in Wuhan, China. The first case was reported to WHO towards the end of December 2019. WHO declared it a global pandemic on 11th March. Right now, we have over 6.5 lakh cases. I think today it is about 6.64 lakh cases around the world, and over 30,000 people have died as of the current figures. We have also, despite the fact it's a new virus, we have still figured out how it spreads. We know that it's a person-to-person transmission. We know that it comes if you come in contact with infected persons, objects, or surfaces. There is no drug yet, no matter what anybody tells you. Many clinical trials have started, and it may take months before we have vaccines, and it is a long drawn process. And what is important right now, which is being harped upon everywhere and constantly being driven into the messaging is trying to be driven among people, is that you have to focus on social distancing, personal hygiene, wash your hands with soap frequently, don't touch your face, mouth, and nose. And that is the only way of preventing, because right now, since we don't have a cure, so it's prevention that we have to focus on. As far as India is concerned, the first case came around at the end of January. It originated from Wuhan, but I mean, the person was from came from Wuhan. It was declared in Kerala. As of today, we are inching in on the 1,000 infected cases mark. We have 87 recoveries, and there have been 25 deaths so far in India. We declared a nationwide lockout on 24th March, as we are right now in the 21-day lockout period. But this is the biggest story of our lives right now. This in our living history, I don't think we've seen anything like this. Right now, as journalists around the world will tell you that it's whether it's not just about a medical story, a scientific story, or an economic story. The Olympics getting cancelled makes it a sports story. Our entertainment divisions are doing a lot of stories on celebs. Of course, Kanika Kapoor helped make matters worse. But so every division, every vertical is focused on this story. We also are being constantly as media highlighting the symptoms, because that's something that people need information on. So what are the symptoms? How do you know if you should reach out for help? Um, Cough, fever, breathlessness, sore throats. These are things that we are constantly putting out on, information on, because these are things that are actually being misunderstood or not. Everyone is confusing it with flu. The questions that we constantly get is, how do we know it's a flu or it's infection from coronavirus? We also know that coronavirus is highly infectious, but what we've also figured out is there have been worse viruses that we have actually won battles against, like smallpox and measles, etc., which were more infectious than coronavirus. It's just that because it's new and it has spread so quickly is where the challenge is right now. We also know that the conclusions that have so far with the evidences across the globe that we are learning, and these are things that we are putting out as well, that it is highly infectious, um, but if you take proper care and if you take proper prevention, it doesn't cause that much of mortality. So if you look at swine flu, etc., they had higher mortality rates than coronavirus is. So it's just about preventing and prevention that we need to focus on. From the evidence that we have so far, we know that the vulnerable age group is 80 plus. In China, it is, I mean, if the mortality rate was, 0.25 between 9 and 50 years, it's 14.8 8% in 80 plus age group. So these are things that we know. And why is everybody talking about social distancing? Because again, these are things that you have to keep informing people about why social distancing is important. Because it's a highly infectious virus, a person can infect in 30 days some 406 people if there's no social distancing. But if there is social distancing, that if the lockdown, for instance, if there's 75% less contact, then one person can infect only 2 to 5 people. Which is These are kind of information that needs to go out to people so that people don't panic, because there is reason for people do panic, and if there's so much of information floating around and a lot of it is misinformation, it can lead to panic. And that is something that we need to tell people, that it's not so bad, because yes, if you maintain these basic 4 5 things, we can win this war, because we are at a war with an enemy that we still don't know a lot about. For instance, we don't know how long the virus survives on various surfaces. The reason there are studies which say that from on certain metal surfaces and plastic, it survives for 3 days. Some, I mean, a lot of the queries that when we do call-in shows with doctors, a lot of the queries that viewers have is it there on currency notes? Is it there on paper? Does it transmit through veggies and groceries? The answer is, right now, these are all matters of study, and WHO has not put out anything as of now, because we're still figuring out things about this virus. The question whether, if a patient is recovered, can the person get infected again? There is a chain of thought that maybe the person will build an immunity, but we don't know about it. We can't be sure about it. Then when exactly does there are a lot of people who are asymptomatic, but they could still be contagious. So at what point does the transmission, the virus starts spreading from that person? Who was the patient zero? Like, there are a whole lot of conspiracy theories about the virus being created in China lab, that it came out from vet. I mean, what so far we know is that we are guessing that it came out of the vet market in China, because the 40 patients, I think, were linked to the market. But we don't know the patient zero. We don't know exactly, because we haven't gotten down to that, and Wuhan was under lockdown. And what is exactly the source of the virus? So these things are still not known, but you will find enough conspiracy theories around, or floating, and you would have, I'm sure, seen it. Now, what everyone claims to know in these misinformation, that there are quick fixes, easy solutions to kind of fight this virus, homegrown remedies. The behavior of the virus, like I said, conspiracy theories about Chinese labs, and it's China's big conspiracy to put the world, or, kind of stall it. They're all enjoying the lockdown. Origins of the virus, treatment, etc. These are the common claims and fake news that are circulating, that we are fighting as media houses, WHO, like I said, doctors, everyone, because this is becoming a problem. Um, for instance, I was preparing for this webinar. This message came to me. One strand of my family is Bengali, so I know the language, from my uncle. And he's a well-meaning sort of retired government official. But he sent it to me, and what it reads is, and it attributes this whole news to CNN and Dr. Li Wenliang, who was a whistleblower doctor from China, who actually broke the news about the outbreak, and he passed away. He succumbed to the disease. Now, this, if you, the message talks about the fact that certain ingredients can cure it, can fight coronavirus, and it's found in tea. So drink tea 3 times a day, and you will be okay. And this came to me just, I think, yesterday or day before, and I've kind of spoken to him that this is fake. Please don't go by this. But he's been drinking tea anyway. Um, so now that's the real problem, right? I got that message. I haven't forwarded it, of course, because I realized. But people might forward it. They might think that they're concerned, right? This is attacking our family, our community, our friends, our colleagues. So we want to spread it. If we get to know something, it's good to pass on. And that is where the problem is, because how do we judge what is truthful, what we should go by, and what we shouldn't? Um, Sometimes it's harmless. I mean, drinking tea won't be dangerous, but there could be other things, right? That might become dangerous. So it starts with an idea that is floated, and then it spreads. And then the panic, concern, and you're kind of transmitting the misleading information, and sometimes the damage is quite irreversible. For instance, in Andhra, when a man got to know that he has coronavirus, he actually killed himself because he didn't want to spread it to his family. Now he's obviously panicked, because he doesn't realize that he can recover. It doesn't have a high mortality rate. If he just goes into self quarantine, he didn't wait for all that. He didn't know all that information. So he just panicked. Then there are cases of stigma, like we are seeing, talk about how people are, now. I mean, I saw, even I think yesterday or day before, China virus was trending, and so we have a certain kind of stigma being attached to northeastern people from the northeastern origins. Or air hostess from Indigo had put out a video how she was being harassed because they feel that she might be contagious and might be carrying the virus. Or the doctors, I mean, they are the frontline people who are fighting this battle, and yet there are stigma being attached, or they're being discriminated against in their localities, that the fear that they might spread the virus. So these are real problems. I mean, because people are not understanding, or not enough good information is reached them, that don't worry, social distancing will take care of it, wash your hands, it's simple, prevention is simple. Just because there's no vaccine doesn't mean that we can't win this battle. What kind of misinformation are being spread? So there's misrepresentation of facts, there's misleading information, putting things out in wrong context, they're actually incorrect. Sometimes they're being manipulated content, unscientific claims, and outright lies. And we'll see examples of each one of these. Um, like this: aspirin can cure coronavirus infection. It's factually incorrect. We have no such evidence, or any no doctors have said anything. Cow dung and urine is the famous one. We had a Gomutra party, and one of the volunteers fell sick, not from coronavirus, but something else. But it can't cure coronavirus, so it's factually incorrect. Meat consumption is the biggest misleading information floating around, just because it is claimed that it happened in the wet market where animal meat was being sold, but I mean that was a different kind of chain, and we're still establishing that chain of how the virus got to humans in the first place. But it's not from consuming meat products. And this map, for instance, was being spread, that how Wuhan residents have traveled all over the world before the outbreak, and that's how this disease kind of spread globally. This is again misrepresentation of facts. This is a myth that, and WHO has actually got a mythbuster section on their site just to tackle this kind of information that salt water or vinegar can prevent coronavirus infection. We have no such evidence. This Dettol is capable of killing COVID-19. According to the manufacturer, they've put out the image of the label of the back label of the Dettol this thing, which is again misleading. There's no such thing. Now, journalists, again, we are essential services. A lot of my colleagues are working on field, risking themselves. Basically, to count the jobs right now in front of all of us is basically to counter misinformation, informing audiences, reiterating the messaging of symptoms, precautions, what needs to be done, why are we doing all of this, why is this lockdown important, what is flattening the curve that we keep talking about, what are the different stages that we are now hoping that India is not in stage 3, but there's no community transmission. But what are these terms? What do they mean? There's scope for in-depth reporting. There's so many aspects to this story, every possible aspect. But the most important right now is to keep verifying. There, getting our resources, getting experts, the right kind of experts, constantly verifying. The Ministry of Health is putting out almost daily briefings and data. States are doing a lot of things. So relying on actual reliable sources, verifying everything is the job of the journalists, of course, that every organization should be doing, and not falling for any user-generated content. There's so much out there. But if ordinary people, like, if we get, what are some of the things that we should follow as a thumb rule? If it is too good to be true, it probably is not true. Let's go with that kind of a rule in our heads, that if something is really shouting out to us, then it's not true. Now, would be great to hear from you guys if you have kind of got any such, what have you guys heard of coronavirus infections, that anything simple, easy ways to prevent COVID-19 infection. Put it in the chat box. We'll what have you heard, and what did you do about it? Like, did you verify? Did you spread it? What did you do? Did you read something very distressing about the health condition that this brings? What are the kind of things that you have seen, and which is why you're probably here to know how to tackle misinformation? Something that may have sounded really far-fetched. See the chat. Okay, I can't right now just see the chat, I think.
Yes, Sonia, you want some help on the chat?
Yeah, I can't see the responses, I think.
All right, so people are mentioning that.
Yeah, okay, it's open for me. Wait.
Yeah, it's open for you, right?
Yeah.
So there are certain fake news that they are listening to. I think
hot temperature, yeah, that's a big one.
garlic fried in mustard oil can keep corona at bay. is what
Yeah,
people are
one of
saying.
the people just joked that
Yes.
all the industries are collapsing, but garlic might just, bail the economy out because people, the garlic one spread really quickly. Hot temperature, again, is a very, very common thing. People are hoping that Indian summers will take care of it. There's no evidence of it. Because right now, across the world, where it has spread the different weathers and patterns that it is spread in. Drinking rasam. South
Yeah.
Indians coming up with that. Newspapers can spread corona. Yes, again, we have no evidence of paper and how long a paper currency notes they were, kind of how long the virus survives on it. There's no evidence of it right now. So clothes, for instance, I mean, because we as reporters who are the reporters who are out of the field, they even wanted to know. So right now, go with the premise that if you're stepping out of your house, just be aware of what all you're touching, and wash your hands because we currently don't know how long it lasts. Cow urine, of course. Yeah, turmeric, homeopathy medicine. Now, this one came actually on the PIB Twitter, Ayurveda and homeopath. Again, these are not scientifically verified claims, so please don't go by that. Verify. Like there's nothing that uh, more that you can do is to verify from sources. There are enough sources right now available, credible sources. Every day everybody is putting out from WHO, like I said, to the government, to the media. We are all trying hard to make sure that the facts get there. We even do, like some of the media houses, including us, we're doing call-in shows just to satisfy these queries of people, because there are lots of these doubts that are floating around. People have asked us questions about pregnant women. How do I take care of, does it, if a woman is pregnant, does it affect the child? Right now, there's no evidence of it, as one of the doctors told us. So yeah, there's too many doubts, and because we are discovering things about it as we go along, so I think that fear and panic, of course, is there. So we need to kind of make sure that people get the right information. So coming to verification of images, this is a very basic. Shivali, you can see my screen right now. I just want to confirm.
Absolutely. Yeah.
Okay. So verifying images. Now, the basic tool, if you would like, about verifying images, is the Google reverse image search. Now, if you go into images.google.com, that's one way of doing it. There are also, if you just right click on a Chrome browser, if you just right click on the images, it gives you the option of searching an image on Google. There are a lot of, basically, what does the Google reverse image search do for you? It can, it tells you where all the images have appeared. Suppose there's an image that you've got, so you can figure out where all it has appeared. It has, the context in which you've got, is it the same context in which it has appeared in the past, everywhere else on the web. Um, and you can also check if it is an old image that is being recirculated, because that happens all the time. In fact, I think there was this whole video of a Indonesian market being circulated as, China Wuhan market, and all sorts of things that keep happening. The wrong places, wrong images from somewhere else being showcased, out of context, or it has appeared, it's an older image, some 2019 image or something that is now currently circulating as coronavirus. And so you can also kind of identify, which needs a lot of time and patience, where did the image appear first. So finding the patient zero, as it were, on for the images, so that you know that this image is right now being circulated as X, but that's not how it was. It appeared 10 years ago, 2 years ago, and we've seen in fake news that happens all the time. Even when Pulwama, Balakot, we've seen that Naxal attacks of 2010 being circulated, images being circulated as Pulwama attack. So that happens all the time, and coronavirus is no different. Apart from Chrome browser, which gives you the right click option, or you physically going to images.google.com, where you can upload either the image URL or the image itself, there are these Chrome plugins. I don't know if you can see it on my screen. The Chrome extensions actually just appear on your browser on the top corner. They appear on the when you add to Chrome, they just appear on your next to the where you type in the URL. So that will give you the option of the search Google with this image on the right click. There are other tools also, like Revi, reverse image search, which help you do the same thing. They're just different tools. and you can all add it to the, like you can see the add to Chrome option. There's a basically Chrome extension, so they'll appear on your browsers. What Revi also lets you do is search other search engines. Now, of course, Google is the big daddy of search engines, and 90% of the traffic is there. But for images, we also find that Yandex, which is the Russian search engine, is a very good one. I mean, in fact, a lot of the images, they do a better image search at times, I feel. And Baidu, for instance, which is for China, if you're actually trying to verify something, which, especially like here, where some images from somewhere else is being touted as China, so you Baidu search engine. So Revi and all give you the option all search engines in one go, or you can do individual Google search or other search engine searches as well. And it is always advisable to do searches on other search engines as well when you're trying to verify something, because Google may not always throw the result. Also, Google depends a lot on the keywords. So if I do an image reverse search, sometimes the keywords, it may not pick the right keywords. You may have to punch it in, because Google works on the better when the keyword plus your image, it will do a combination of it. So the sharp, you might have to change the permutations and combinations of the keywords to get the right search results. Also, you might have to go to other pages. Just don't rely on the Google first, whatever the search engine throws up on the first page itself. Sometimes it's an older image, etc. You might have to go a little back in time. Although I think Google also gives you the option. Uh, it also gives you the option to customize the search, so that if you go to tools, for instance, I hope you guys can see my screen. It gives you the time option, so you can also look at past year. Suppose the image is old, or you can custom arrange and see if you're trying to see, suppose if something is going viral today, that means it should not be in the system, or it should not have appeared in the system before today, right? So if we know that coronavirus started in uh, you know, right now just putting a random thing, that 29th Feb, then if you put it in 29th Feb, and you go, it'll show you all the search results before 29th Feb. Now, if the image suddenly appears before 29th Feb, you know that this has appeared in the past, so it is not true for today. So you can do, date searches. You can set the date. So basically, if you go to tools and if you do a time thing, you can do even that on a Google reverse image search. Coming back to the thing, so like for instance, this particular image that was circulated, that Italian man who lost his entire family to coronavirus finally commits suicide at the top of a hotel. Now, I mean, this is circulating, and given the fact that people are all worried and anxious, something like this is disturbing, just as the Andhra man's suicide is. Now, in image reverse search, you also have the option of actually using a sniping tool, of cropping images, because sometimes it gives you a sharper and better result. So suppose we kind of use a sniping tool to take the hotel, because in the image you can see the hotel name, and do a reverse image search. Then you will find it'll load results like this. Now, and immediately you will see the search results actually has something which is December 27, 2019. Now in Italy, coronavirus hit in Feb. So automatically there are stories which are talking about somebody else who kind of jumped off the hotel in Spain. And that image is being used right now out of context to show that somebody has committed suicide in the case of coronavirus. And so these stories, and there are videos and enough material on which was done and covered during that event, which happened in December 2019, actually December 27th, 2019. And there are a lot of Spanish search results that will come, in which you can use Google Translate to kind of figure out. I mean, not all of us know Spanish, so hence it's fake, because it's an old video or story that is being circulated in today's context. Now, in terms of video verification, the tool that which is used most commonly is Invid. Again, Invid is you can download the Chrome browser extension. Now, what it does is it can you can put in URLs of Facebook, Twitter, YouTube, of course, and you can also upload videos. So if you've got a video on WhatsApp, you can upload that as well. Um, and these are all the things that you can actually analyze from InVid. You can actually get uh, metadata of when it was uploaded, what are the image. You can also do a reverse image search of the thumb image that you can do. But basic function that it does is it breaks up the video into still frames. If there's a 2-minute video, it'll break it into keyframes, and then that keyframe is what you do reverse image search on. So basically, the video is a layer on top of the Google reverse image search, and it has the all the search engines built in, so you can directly do a reverse image search. Plus, it also has these nifty little things like magnifier, which can, kind of, if it's a good resolution, and sometimes the videos that you actually see on fake news are not great resolution, but you can also magnify it if it's a number plate or it's a signage. You can probably the billboards or something. It gives you the magnifier too, so it just highlights it a little better. Um, and of course, I don't know how many of you used Twitter Advanced Search, which is slightly more detailed than the search that you have on the Twitter when you load, because that enables you to kind of actually look at certain handles that have tweeted, hashtags you can search with. So this helps you do that for videos with you can put a time frame, calendars, customize, and do a better search of videos that are getting uploaded. Sometimes user generated content that you want to sift through, or you want to see what certain handles have tweeted, so the government handles something, you can do all of that also. So for instance, this particular video, um, if you play this video, it actually shows this row of coffins with dead bodies just going, and they say that this is in Iran, and because of these are deaths that have been caused due to the virus. And do you still want to hit the streets unnecessarily? Make a choice. I'll try and see if can you see the screen. This is what the InVid tool looks like. Shivani, can you just confirm if this?
Yes, it's absolutely fine. Yeah, we can see
Okay.
the various frames.
Yeah. So basically, this is what the InVid tool looks like. So it has an keyframes. You can actually do reverse image search of YouTube thumbnails, the Twitter search that I was talking about, the magnifier tool, which works only for images. So right now, for instance, I uploaded this Iran video. So here you can insert URLs, you can upload videos, and then when you submit it, what it does is I have already done it so that we save time and internet and whatever. So it breaks it into all these keyframes. You can then do a reverse image search like right now I'm doing. Now see, I have the option of search Google for image. Now in this fake news, which is the InVid, if you can see the in my right click, I have the image magnifier, which I can do it on the image, so that if there was a number plate or something I want to see a little clarity, I can magnify that. Or here are all the search options, right? Google, Yandex, Bing, Tinai, Baidu, all of that. So you can either do reverse image search on all at one go, but that will mean a lot of tabs and slowing down, or you can do it one by one. Now, in this case, Yandex had a hit. I also tried Google, and I had reworked the Google keywords, and I'll try and show you that. But Yandex matches images a lot better, so you can easily see that it has matched my images. These are the search results it's thrown up, and through that I found that through the Yandex thing, that there is this video of which is for 2019, which is August 2019. This was an accident that happened during Hajj, when I think 58 people, kind of got killed. So this is a very old video, not even of Iran, completely out of context, which has been circulated. And so even I think, yeah, so even Google did like Google, I had to play around with this keyword search, because it was it I think showed me the go-karting thing, like when I did the reverse image of the keyword said go-karting or something. So so I had to change the keywords, and it's a little bit of this thing also, but I did find some of the articles etc in Arabic, which did put our date, which is 2019. But Yandex immediately kind of threw up the images itself, so it was easier to kind of reduce the time of my verification search. So that's how the Invid tool kind of works in a very nutshell sort of thing. They have a tutorial, etc., and they're very good with feedback if you get stuck with this button that they have. If you sometimes it takes a while to break it into keywords, and also they respond quite quickly. So yeah, this is just as we kind of looked at all the keyframes, and like I said, Yandex was a better threw up a better search result. So yeah, it's a 2019 video that actually was. It's not a very nice video. I can play it, but it just shows rows of coffins just going. So yeah, now when you're looking at a video, or you're looking at and it's true for anything, any image or anything, look for all these, watch it very carefully, watch the video thoroughly, because you can also hear the audio sometimes and they hold clues. But look for the things around. So you can look for landmarks, you can look for number plates, clothing, language. Sometimes they hold the clue. Like we have had issues where during Kerala, videos from Kerala were being circulated, and billboards with signages and languages that kind of said, "Oh, that's not a Kannada billboard." So those detailing is very, very important. Buildings and landmarks, for instance, recently there were this whole stories about how because of the lockdown in Venice, all the dolphins and swans, etc., have returned to the canals, and it's a very nice story, and in these gloomy times it's a very pleasant story. But fact checkers were not taking it for granted, so they went to Google Earth, they went to Google Maps, because Google Maps gives you a street view. So they were trying to match the image of, you see these nice pretty bridges and the buildings of Venice, and you see the dolphin with the image that was circulating. So they mapped it to see in the street view if those bridges actually existed, where the location that we're claiming, that is Burano, I think they were claiming in one of those islands. And so they actually showed that, yeah, the street view matches, because the street view of Google Maps gives you 3D sort of um, images of the location itself. Also, comments hold a very crucial role in sometimes identifying its fake, because people call it out that, no, this is not true, this is not Bombay, or this is not Delhi, this is not true. So sometimes that also gives you a clue. So go through the comments. So all these things, buildings, landmarks, etc., they hold a clue. Now, just quickly going through when it happens on WhatsApp, because WhatsApp, like you can't do a Google reverse image search unless until you're uploading the image, etc. There's no link. Also, it's private, right? Now, what is circulating in family groups, it's not accessible. At least Facebook, Twitter, etc., we can access. YouTube, we can access the content or track it. But WhatsApp is a black hole. So the first question to ask is it a forward? Okay, so if it is a forward, then what is the source? Who's forwarded it? Is it coming from a credible source, like a government or WHO? There can be false claims, but these are questions to ask, so that at any stage there can be a red flag. If it says it claims WHO, then go and look at the WHO site. Like you can, if it's a government source, check the government source. Is the image or video genuine? Now that's something that you will have to use one of the tools like reverse image search or Invid to just figure it out. That can you crack it? Can you debunk it? Is the post hard to believe and you still want to? Sometimes, like, it seems like it's nice to believe that garlic or turmeric, which we know are good to have in your diet, you want to believe it, right? That it's infection at the end of the day. It's cold. We talk about ginger tea. We talk about these things. Gharelu nuske, we all do. So you want to believe it. Ask these questions to yourself. Don't forward till you've answered these questions. So, for instance, after that whole, when the Janta curfew happened and the clapping, and the clapping and clanging of utensils was done just to, kind of say thank you to the frontline people who are fighting this battle for us. This WhatsApp kind of message was floating around that NASA satellite videos, not only live telecasts have shown, and it goes some SD13 wave detector, that that the coronavirus is diminishing, it's weakening after all the on all the noise that we made. So it's proud to be an Indian. And this whole thing circulated so much. I think Amitabh Bachchan, everybody talked about it, that it's supposed to, ward off evil, all the noise that we make. But the point is that there is no detector called SD13. We can check the NASA website. There's nothing. So if we, instead of just forwarding it, just because we feel that we feel good about it, just cross-checking would bust it. We don't need to send it and make it viral and spread it. I mean, Amitabh Bachchan had to take down his post. Sonu Nigam, for instance, because the Janta curfew, when Prime Minister Modi announced it for 7 to 9, he posted a video saying, the coronavirus only lives for 12 hours and we are doing a Janta curfew 14 hours, so we are tackling it. It'll be over, it'll be gone. Actually incorrect. It's a celebrity who's with a wide reach who's posting something like that. So these things need to be verified. If it was dying, if the virus dies in 12 hours, the entire world wouldn't be battling it still. Always cross-check with websites that have credible factual information about the virus and infection. We can't harp on it more. Please don't believe in anything. Here are some of the websites that you should, if you have, people are suggesting medicines all the time. Center for Disease Control and Prevention, CDC, has a huge FAQs on medicines, because there are things like BP medicines can aggravate it, or so-and-so medicines will work, all of that. Please do not take any medicines without consulting the doctor. And any doubts, please ask the doctors. There are helplines that are available. Ministry of Health has it. Every data is being put out. Test centers have been increased. All of that information is on ICMR websites. States, a lot of the states are doing very good job of this. If you need testing labs and you want information around it, you can go onto this website, which is the health analytics thing. This particular actually has a Google map which will tell you all, and it's getting updated all the time, because the testing facilities, the private players have been allowed, so it is improving all the time. So bookmark this website. There are a lot of fact checkers globally, and of course within India, who are doing working really hard in fact checking each and every misinformation. So if you get something, please cross check. You can go onto these websites to kind of Alt News, Boom Live, Vishwas News is in Hindi. You can go onto any of these websites. If you want any newsroom trainings, this is the website to go to. One of our trainers can be, and we do trainings in different languages. Like I said, I think our next webinar is on 4th April. We have 2 webinars actually, one in Hindi, which is at 11 a.m. and one in Tamil, which is at 4 p.m. I think one of my colleagues will just put in the registration link for you. You can register for that. Professor Umesh Arya is doing the Hindi one, and Raj from Data Leads is doing the Tamil one at 4 o'clock. The Hindi one is at 11. That's pretty much it from my side. If you have any questions, please go ahead. Also, if you want to register for the 4th April webinar, I think the registration link will also be on the chat that you can look at. And of course, we also are doing it in other languages apart from Hindi and Tamil. Bengali follows, Malayalam, Marathi, all of that follows. And that schedule can also be, it'll be there on the registration link.
Thank you so much, Sonia. You were really wonderful, and I just hope that all the people who've joined via YouTube and via Zoom found the webinar useful today. As Sonia said, that we will be doing language webinars very soon. So the second ones are on the 4th of April, which is at 11 a.m. And then in 4 p.m. we'll keep you posted. We will post the webinar registration link on the chat. But before this, I will just take maybe 3-4 questions on fact checking. Sonia has covered pretty much everything regarding the fact checking, but I just quickly came across a few of them. So I'm Sonia reading them one by one to you, so we can just quickly answer them. So the first one is from Soma Das, which says, there is a rumor going around that vegetables and fruits can spread the virus. How do you answer that?
Well, there is, and this is a question that we got a lot on our call-in shows with doctors, and there's nothing to suggest anything like that. But whatever is coming to you from outside, which is whatever you're taking, whether you're buying or it's coming to you delivered on cardboard boxes or whatever, be very, very careful. Wash your hands, wash the vegetables, because right now it is just about making sure that you wash your hands and you're not putting the hands on your face, mouth, eyes, nose. That's how the infection spreads. So it's about washing and disinfecting. Uh, but right now, there's no suggestion that if you eat the vegetable or the food, that will have anything. Please don't go by that. There's no such thing. We right now only know that it's a person-to-person transmission.
Perfect. Thank you so much. So the next one is from Besaki Mohapatra. She's saying, can we trust? So there are a lot of websites, dashboards are going around. So she's asking, can we trust COVID-1918.org?
It's a very good website because it's doing a lot of visualization, etc. But it's not a government site. And they put it out very clearly in their about us. That's the other thing. When you're checking sources, is it a journalist? Is it a doctor? Who's saying it? That particular website I know because the numbers don't match in terms of number of cases, etc. Right now, we are only going with the government. So even like for instance, NDTV also has a dashboard. A lot of the other News 18, etc. Everybody has the numbers being put out. We are going by the government, and we are going figures. Just go to the ministry site. Also, very important to highlight recoveries because the recovery is faster. More people are recovering than deaths. So when I mean, numbers also have to be put in context because right now the numbers should not cause a panic. Because if we see a spike, which we might, uh, we should not start panicking because the recoveries and death figures are something to look out for. People are recovering, and people do. Most majority of the people will recover without medication also because it's not that fatal a virus, and that needs to be put out there because people start panicking. 194 cases, like it is true, 194 cases we did see a spike yesterday. We will see spikes because there will be more testing as government tests more people so that we can isolate and get rid of the virus. We will see a spike and then the fall. Most of the China is seeing that right now. I mean, US of course did not tackle it very well, but US, if they would have been 2 weeks ahead of the schedule, they probably have better facilities to tackle it. Right now, the thing is not to panic, and please don't go with too many dashboards, which is why it's an infodemic. Um, go with just credible sources. Do not look at too many dashboards.
Thank you so much. Yeah, you've actually pretty much covered all the points, but quickly taking a couple of them that have just recently come. So one is from Aparna. She's saying, is there any way to check the source of WhatsApp video or videos coming without the URL?
Yeah, so in InVid you do have the option of uploading the video and breaking it down into keyframes. That's the advantage of InVid because InVid has the field for you to put in the URL as well as for you to upload any file that you get. So it could be either or. Yeah.
Great. So the other one is from Malika. She's asking, is InVid free or is it a paid one?
Sorry, what
is InVid free or is it a paid?
It's absolutely free tool. It's a free tool, and they constantly it's an open source tool. So sometimes if it, like I said, if it sometimes gives you it takes a time or it's giving some error, they normally take feedback very quickly. But it's a free tool.
Great. So, I mean, I can also see that some of our fact checkers are also debunking a lot of fake news on the chat. So, just in case, I've seen that a lot of questions are answered right there and there. Dr. Debanjan has answered few of them. There is one that's going around again and again is that currently this is a question from Avinash Sahu. He's saying that currently one of the most searched parts regarding COVID-19 is its medicine and the vaccine. Yeah. How to trust which news is veracious and which is false?
Again, the websites that we kind of said, WHO is your first source, CDC, the Center for, I'm forgetting the full name of this thing right now, communicable diseases, I think. Those websites, ICMR in India, Ministry of Health, there are no vaccines right now. The trials they're going to begin. So right now, there's no question of a drug or a vaccine anywhere in the horizon in the near future. It's just in the trial stages. So, and only go with right now WHO globally or Ministry of Health. Nothing at this stage.
Yes, perfect.
And
So
no recommendations. Also, one of the things is when we do call-in shows, a lot of people ask, "Oh, will this work? Will that work? We've heard this medicine will tackle." Not, we should not go with any drugs without doctor consultation. Sometimes you recover without any drugs also. So it's all about what your condition is, what medicines you're already on. Please consult a doctor.
yes, that's really important. So there's one from Galaxy M30, no name written, but how can we check the WhatsApp audio content? There is a lot of audio content that's going rounds too.
Unfortunately, there's no verification tool for audio at this point in time, but if you're hearing something and it's giving you some advice, doing a simple Google search and looking for again the credible sources, are they validating the same thing, might help. Sometimes the audio, I mean, audio is a tough one because anybody can do anything. But I think fact checking would mean that what is the content of the audio, and do any of the other credible sources talk about it. I think that would be the uh, way to go for audio.
Great. I think we've pretty much answered all the questions directly, indirectly. Some of our fact checkers, like I said, are already on the chat and they're debunking right we are talking here. Just in case we haven't answered any of your questions, please feel free to write to us and we'll be happy to do it.
I can see something that's come about a text. Like if there's no image or video, and if in text comes, do a simple Google search. Whatever claims you hear, there would be all credible sources have put out FAQs. They've put out every kind of Q&A sessions. They have put out, even WHO has put out WhatsApp numbers on their website very prominently, where you can actually send a message and they'll respond to you. There are helpline numbers of health ministry, everything. So like I said, please confine yourself to one or two credible sources and just go to them. So even if text, just see if that text, whatever it claims, is validated by a WHO or not. Don't read too much. Don't go into too many sources. Just go to few credible ones at this juncture, because it is a matter of life and death. We can't be fooling around with these kind of things. It's medical, it's scientific information. A lot of it people don't understand, so we need to be very clear on that.
Yes, thank you so much. Thank you so much, Sonia. I think the questions that I'm receiving now is just a repeat of what you've answered or you've covered by way of your presentation. The presentation was great, and I really hope that all our participants today benefited from this. Like I said earlier, that we will be repeating this in different languages. The webinar link, Shivali, my colleague Shivali, has already posted on the chat group. Please copy it, register, help us spread the word around. Also, just take out just 2 minutes of your time today, and if you can fill in the participant feedback form and let us know how we did and where we can improve, it will really help us. So thank you so much, everyone. It was wonderful having you all today. Stay safe, stay away from fake news, and wherever possible, just try and debunk it. Thank you so much. Wonderful being with you all.
Thank you. Thank you.
Thank you, Sonia.
Thank you so much,
Shivali.
Sonia.
Thank you.